Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter S. Today I'm going to talk about the spinal cord and the spinal nerve diseases. First of all, let me just bring up the emergency situation. Any diseases associated with the spinal cord or the spinal nerve involved emergency visit, trauma, injury. I think that's the first emergency situation came into my mind. Or regardless whether it's the spinal cord or spinal nerve, if there's some impaired function, lost the strength, either the limb strength or the sensation. So if that's the case, it's an emergency situation. Usually the spinal cord or spinal nerve disease, first of all, let me just bring up the difference. Probably you know it, spinal cord versus spinal nerve. One is central nervous system, the other is peripheral. So the spinal cord is extension from the brain, connected to the medulla oblongata and running through the central canal and also the intervertebral canal. So that's where the spinal cord located, which is similar as brain, containing the neurons. So it's serving as the central nervous system, and the spinal cord has if you section it, view has the horns and also the anterior and posterior horns. That's the anterior horns, just like the frontal lobe of the brain, responsible or containing actually the ganglions or the neurons of the motor nerves, so responsible for the movement. And the posterior horns is just like the parietal lobe of the brain, responsible for the sensation. So the spinal cord really serves as the connection from the spinal nerve and then through the spinal cord, through many of the neural tracts, okay, connect to the brain, spinal cord, and those tracts are the nerve fibers, and there's a ganglia in between as a transition of the changing station, the signal exchange at that station and then passing up or pass down. So this is the spinal cord, the major function of the spinal cord, like the reflection, for example. So it's a very, give you examples, you touch the heart plate and then through the spinal nerve, okay, the peripheral nervous system receiving the signal, and through the posterior horn, which is the sensational neurons located, and there the exchange of the signal, okay, just like the mail passing from the one station to another station. So the signal already through the spinal nerve reaching to the spinal cord and the posterior horns, and then anterior going up through a lot of the sensational ascending tracts. Those usually are the sensational tracts sending the signal to the brain. Okay, so the brain receives the message, the plate is hot, and then through the brain passing down along those descending tracts, so which is carry the motor signal. So this motor signal and spine landing to the spinal cord anterior horn. So at there and changing the signal to the spinal nerve, innervate the muscles. Okay, so the muscle got the signal, you have to contract to move your arm away from that heart plate. So this is basically explain the spinal cord function, serving as the station of the signal passing along the brain to the brain or to the muscle. So this is about the spinal cord, and the major diseases caused the spinal cord disease are the injury. I think one of the most common cause of injury. Some also have genetic causes, and some autoimmune causes like multiple sclerosis, for example, and also some other causes like the infection, the serious infection, either viral or bacteria, can cause this advanced infection, cause chronic advanced, cause this spinal cord disease. the spinal cord injury usually causes the paralysis of the section. And if this, the multiple sclerosis, for example, I mentioned before, it's affecting the demyelination process to affect the nerve signal passing along. So if it occurred in the spinal cord, so it's the same idea as occurred to the brain. And the white matter actually is the nerve fiber myelination is affected. So that's the common disease of spinal cord. In terms of the difference between spinal cord and the brain, usually the spinal cord damage, sometimes there's upper neuron or lower neuron symptoms. Basically, those are the medical terms. The spinal cord damage usually is the flaccid. It's not like the cortex in the brain damage causing this rigidity, but this spinal cord damage usually is not that like the cortex damage without the rigidity, but on the other hand, it's a flaccid. So the limb of the limping of the limbs, so which means lost muscle strength and atrophy if it is long term. So this is about the spinal cord. The other clinical significance of the spinal cord is served to for the diagnosis through the outer layer of the spinal cord, not the spinal cord, through the lumbar puncture. Probably you heard it. Going through different layers of meninges extended from the brain to the wrapping the spinal cord, and then drew the fluid. It's called cerebral spinal cord fluid, spinal fluid, which to send to the lab to test to examine the cells, the protein component, or whether there's some bacteria for culture purpose to diagnose the disease. It's either autoimmune or the viral or bacterial infection. So that's another significance for this associated with the spinal cord. In terms of the spinal nerve disease, I think I mentioned it before, it's a peripheral nerve disease, which the reticulopathy, for example, the peripheral nerve rooting out from the spinal cord could be compressed by the intruded hernia disc, or by the inflammation on the canal, getting the passage of the foramen getting narrowed, pinched. So that's the peripheral nerve disease. Usually the peripheral spinal nerve disease easily localized actually. Sometimes it could be diffuse because there's the interconnections of the spinal nerve together. One nerve has the connection with the other nerve, so make the symptom diffuse, but in general it's localized compared to the spinal cord diseases. So this is about the spinal cord and spinal nerve. In terms of the preventive, or I think it's really the spinal cord is just like a brain undergoing the natural process. Like I said, the common cause of spinal cord disease are the injury or infection. So this is, I think it's difficult to, or some of the, for example, the infection which can be prevented, sometimes viral or bacterial through the vaccine. But in general, it's really, the important thing is early diagnose. If there's anything you feel not as regular, or after the injury, go see a physician as soon as possible. So this is about the spinal cord and the spinal nerve disease. I hope it helps give you some idea about the nerve system. And I'm going to stop here today. Thank you for watching. I'll see you next time.